Hello, my name is Dr. Cecile Padron. I'm one of the Associate Medical Directors with Orange County EMS.
Hello, I'm Thomas Doty. I'm a paramedic here with Orange County EMS.
We're going to be covering how to apply Cpap for a patient requiring oxygen therapy.
Alright, so in the previous video, Dr. Gerber spoke about the indications and contraindications for Cpap. So what we're going to do is we're going to break this out, go over each piece of equipment and the application of the device. So when you pull out your bag right here, I'm going to set this on our patient for video purposes. So when you pull out the device here, you're going to be first seen with this hose here. This hose is going to have what we call the Christmas tree adapter, which is going to be utilized to plug into our ambulance here. We'll demonstrate that shortly. And then you can remove that to plug it into our D-tank oxygen cylinder here. Also, we're going to have this hose here, almost like an accordion style hose, that you can extend or retract for the distance needed to apply to a patient. We're also going to have our PEEP valve here measured in centimeters of water. So you see our PEEP is on 5, 7.5, and 10. Some of these may be preloaded a certain amount, so just check it when you pull out of the bag. So 5 is going to be kind of our baseline breathing status, or our perp slip breathing. So when we're applying the Cpap, we want to go ahead and walk this up to 10 by rotating it clockwise like so. This should take about 3 full turns and it'll stop when you get to 10. So when you look at it here, we're also going to have a viral filter. With viral illnesses being a little bit more prevalent in today's world, we've applied these to our Cpaps, and they should be preloaded, but make sure that you have this on before you apply it to the patient. You have a large end and a small end. This large end is going to be what's plugging into the hose here. You're also going to have an inline net. See if your fire department has one of those. So also when you look into your bag, you're also going to have our patient mask. Sometimes it's going to be in a bag for clean purposes, but just go ahead and remove this. So this mask is going to have a couple different components on it. This is going to have a forehead piece. Now this can be adjusted either upwards and downwards or in and out, depending on the anatomy of the patient. Whenever we apply this to the patient, we'll talk more about applying it directly. You're also going to have these straps here, and after you apply it to the patient, you're just going to pull it over their head, clip it into this bottom receiver, and you're going to tighten it. Again, we'll go over that in a minute. So typically what I like to do prior to putting it on the patient is I like to explain to them what we're doing and why we're doing it. So sir, we're going to apply a mask here to your face today. So this is going to be almost like sticking your head out a car window. You're going to be drinking water through a fire hose essentially. So, just try to stay calm, breathe with the device. This is to help you, okay? So when we are applying this, again, this will apply directly to our mask. Remember that this system is a closed loop system. So if a patient's already having difficulty breathing, we want to make sure that we're plugging this in just so oxygen is feeding through there. So when we apply it, they're just not breathing against nothing. So first I'll show you with our Christmas tree adapter plugging it into the ambulance. So you're going to take this device here, and on our receiver here in the ambulance, it's going to have 2 prongs with a large hole in the middle. This is essentially just going to plug in, like so. And you're going to hear the oxygen flowing very loudly, okay? To remove it, you're just essentially going to rotate it counterclockwise, and it'll come straight out. Now, if we're applying it directly to a D-tank oxygen cylinder, we're going to remove this. And then you're going to have a female adapter piece on your regulator. So if you take your regulator here, make sure that your oxygen is on. You're going to make sure that your oxygen cylinder is on. And then you're going to take it and screw it into the female adapter piece. And again, just like plugging into the ambulance, you hear a loud rush of oxygen. And that'll let you know that we're getting oxygen through the tubing. So for the purposes of the video, just for sound quality, we're going to apply this to the patient just without this oxygen tank. So again, we've described to our patient what we're doing, and now we're going to go through the application process. So take your bottom portion of your mask here, place it to the bottom of their mouth, and rotate it forward to ensure that you're getting an adequate seal. So again, we're applying it to the bottom of the face, and we're rotating it forward, and we're allowing these to rest on it. After we secure it with the straps, we'll go back and assess to see if those need adjusting. So you can hear it click in there, and now we're going to adjust our straps.
And when you're applying this mask, what you want to check at the end is to make sure that there's a complete seal around the skin all the way around the mouth. It's very common for you to have a leak in just one area of the mouth and just have to adjust one corner. After that, when you're transitioning the patient from stretcher to the hospital bed, or vice versa, from stair chair to the stretcher, make sure that you're checking the seal all the way around every time the patient transitions. That's application of the Cpap. Thank you.